Hi, hope you are doing well. In this video, we will discuss the disadvantages that are associated with dental amalgam fillings. So the primary disadvantage that is associated with dental amalgam fillings is poor aesthetics. This is especially true in case of the old amalgam restorations that turn into black in color with age, and they are placed in the lower premolars and molars. Because in this area the restorations are sometimes visible during function. There are health and safety concerns that are associated with mercury that is a part of the amalgam fillings. The dental staff, doctor and the patients, all of them they are exposed to mercury if the material it is not handled properly. There's lack of bonding between the amalgam and the tooth tissues. And as a result of that, there is increased tooth structure removal in case of amalgam restorations. So the cavity size it is large, and the cavity preparation it is large as compared to the composite restorations. Amalgam is a non-insulating filling material. It means it can easily transmit hot and cold stimulus to the dental pulp. So hot and cold stimulus, it can easily transmit to the dental pulp because this filling it contains metal lines. Therefore, a barrier material is required just below the amalgam restoration to protect the dental pulp from this non-insulating filling material. So thank you very much for watching this lecture. Feel free to give your feedback. Feel free to ask questions in the comments below. Again, thank you so much for watching this lecture. Stay blessed always.